boost their real quick. Johnny's Pharmacy, leading the way in healthcare. Would you be missing the party this weekend because of that nagging cold and cough? Boost your body's immunity now by taking Feral Compound, a combination of vitamins and minerals to fight off coughs and cold, so you can be the life of the party again. Don't be restricted by those nagging coughs and cold. Take Feral today and enjoy the little joys of life. Feral Compound is for adults and children 14 years and older. Available at Jolly's Pharmacy and all our locations island-wide.
Good morning, good morning, good morning, and welcome to another episode of Jolly's Health Vibes. It is, of course, a pleasure to be on with you this morning. My name is Trudy Christian, and my co host joining me in studio this morning is Leona. Leona, good morning to you.
Good morning, Trudy, and good morning to everyone listening. It's indeed a great morning this morning, I can say.
Yes, it is the 1st of April. So, to all our listeners and to us as well, welcome to the month of April. The month of April. Today's April 1st. It's supposed to be April Fool's Day. I don't know if people.
Don't be fooled. For the most part, I think in my department at work, we've all agreed not to fool anyone today. On our plates, we don't need any jokes.
I'm not sure it must be age, but April Fool's jokes are no longer things that I do or I even expect. So I guess I'm definitely, not in the age group of April Fool's jokes anymore. But yes, first day of April, and it is moving swiftly along to that halfway point of the year. The year is really moving along quickly. In April, it's big, big, big news for Jolly's Pharmacy as we have the National Wellness 5K run, and that will be on April 25th. So we've been speaking about the run for a while now. The National Wellness 5K run, Jolly's Pharmacy annually does this. And this year on April 25th, the run will be for persons with disabilities. So what normally happens is at these runs, you people register, and the money that is collected for registration goes towards a worthwhile cause. And this year, the cause is supporting people with disabilities. So the beneficiaries will be the Dominica Association of Persons with Disabilities and Circle of Friends. The registration fee for the run is $25, but you can contribute more if you would like to do so. And the locations at which you can register, all Jolly's locations are open for registration for the National Wellness 5K run. And this year, April 25th, remember that's the date. The route, we've been teasing that too. And let me remind, the route is changed this year. The beginning point is the Newtown Savannah, and the end point is Canefield River Estate. So that's what you're gearing up for. $25 registration fee, all Jolly's locations. And the colors that you can wear at this run this year, blue and yellow. So when you register, that donation is going towards the charities that we have mentioned, but you need to put on your own shirt. So you need to get either blue or yellow. Those are the colors. We're also encouraging groups to register. So if you are a part of an institution or part of a team and you want to register collectively to take part in the National Wellness 5K run, you can do so. There will be a prize for the best or biggest group, and there are also prizes for the first, second, and third person to complete the race, first, second, and third place to complete I shouldn't say race, but to complete the run. And also for the oldest person to participate, the youngest person to participate, and this year for the first person to complete the run who has registered as a person with disabilities.
Right. And another thing too, we've included a group prize. So the largest group. So you have many different ways to win. It's not just who's the fastest, but we have other things that we are looking at. So we have the largest group When you come in, you'll notice that you can register as a group, whether it's an official group, a company, or maybe a group of friends, and you just name it Friend Group Maho or something like that. And you have the opportunity of winning great prizes this year. I think we've really outdone ourselves with this year's run. So be sure to come, be sure to participate. Your $25 goes, like we said, entirely to the charity. But just by registering and by giving to this charity, you will be getting a lot of sampling on the run. You'll be getting hydration. You'll be getting, possibly snacks, all of these things. So it's going to be quite an event. And we're asking, even if you cannot make it to the event, give back to the persons who are in need. And disabilities is wide scope this year. So we're talking about physical disabilities, cognitive disabilities, amputees, all of these things. And it's going towards adults as well as children. So for Circle of Friends, it mainly deals with children.
Children, yeah.
That's the Achievement Learning Center. And it's a school for persons or for children, I would say, with disabilities. And so you're supporting these families, you're supporting these children, you're also supporting the parents empowerment group, and that's the parents of those children who are learning themselves how to deal with these disabilities, learning how to give their children the best care. So please come on down to any of our locations. Our office is upstairs manufacturing across from Wesley High School inside of town. You can go there to sign up as well and just give back to those communities.
Yes, so we're talking the National Wellness 5K Run, April 25th. And we're just encouraging you all to register and take part. I see a lot of our regulars popping up on the social media platforms and saying good morning to you all. Good morning, Hazel Ann. Good morning to you all popping in. Of course, if you're listening to the show on radio, you can log on to the Facebook page of Q95 or the YouTube channel of Q95 FM Radio, and you can see us live and in living color. If you are on social media, of course, you would notice that we have a guest in studio, and we do have a very, very packed and interesting show planned for you. We will introduce the guests when we come back from break. But just to let the listeners know, this morning we have a focus with our guest specific to men's health. And that does not mean that the ladies are not supposed to stay tuned in to the program. So this morning when I gave the topic to someone, they said, men, no, that's not for me. Yes, ladies, this show is also for you because you do have men, I am sure, that are family friends that you can pass on information to. So please stay tuned. We're coming right back. We'll introduce our guest and our topic when we get back.
Introducing Jolly's Pharmacy, brand new website, www.jollies.gm. It's your time to jump the line. Shop now at jollies.gm and have your items delivered in the comfort of your office. No more standing in line. No need to use your lunch hour to shop. Hassle-free shopping, safe and secure. Jollies.gm features rush delivery, 1 hour. In-store pickup, regular delivery, 5 p.m. Cut-off time, 4 p.m. It's your time to jump the line. Use the line. www.jollies.gm. Jollies Pharmacy, leading the way in healthcare.
Oh, and if they say convenience can make a big difference, then you can trust me and know just where you should be. That is JP Mega. The one-stop shopping, Dominica, nigga. You could be shopping and having fun. Shop if you're not with your social. It's a to everyone. What a happy place. Oh, JP Mega. The one-stop shopping, Dominica, nigga. You could be shopping and having fun. Shop it's a to everyone. What a happy place. Oh, what a happy place. But just stick some more any item and you automatically qualify for discounts. Check us out at the Mega Store in Fongole where there's lots of parking on Monday to Friday from 9 a.m. to 7 p.m. On Saturdays from 8 a.m. to 6 p.m. and on Sundays from 10 a.m. to 2 p.m. JP Mega, the best family shopping experience.
I woke up this morning feeling mystic. I had the intentions to call it sick, but I end up in Jolly's Pharmacy. And out in the street, and it's some my immune system. Me feeling fit and strong now. I'm ready to work. I become any mission. If you see me again, Jolly's Pharmacy is number one. Jolly's again. We can't talk for everyone. Jolly's again. Boost up the immune system. Jolly's again. Yo, Dominic, it's about father box. Whenever I'm in town and I'm feeling down, I head to Jolly's Pharmacy. They boost me up real quick. Jolly's Pharmacy, leading the way in healthcare.
And we are back with you this morning on Health Vibes. As I said, we have a guest in studio and we have a pretty nice topic lined up for you. And we're doing it with a slant towards the men. At the start of the year, we promised here on Health Vibes that we would pay a little more attention this year to men's health. And so we've had one show already strictly dedicated to men's health. That was sometime in January. We're in April and we're kicking off the month with another show for the men, right? But remember, women, you need to stay tuned in because you are also going to benefit from this information. In the house with us this morning is cardiologist Dr. Michael Reef. No stranger to Health Vibes. He's been on before and he has graciously agreed to join us again on Health Vibes. This morning, we're talking about men and their heart health. Miss Dr. Reef, good morning to you.
Hey, good morning. I'm not sure if I should say Miss Trudy or Miss Kristen.
I almost gave you a Mr. Reef instead of Dr. Reef, and the doctor is very important because I know you worked hard for that doctor. Yeah, I cannot forget that doctor title. Welcome to the program, Dr. Reef. You can, for the listeners who maybe don't know who Dr. Reef is, let them know what it is that you do. I did say you're a cardiologist. If there are any listeners who don't know what a cardiologist does, we want to know.
All right, good morning, everybody. Good morning, everybody in the studio. Leola,
Good
Miss
morning.
Christian, everybody who's listening online. It's indeed a pleasure for me to be here on Health Vibes today. I really appreciate the invitation. To be able to at least share some bit of knowledge when it comes to cardiovascular health, particularly to our men. So we recognize our men as standing figures at home when it comes to contributing financially. So even if you're not a man and you're listening, it's important that we take care of our men. So we start with the hat, right? We start with the hat. So my name is Dr. Michael Reef, cardiologist. I was trained in Cuba. I'm from the village of Wesley. I say that proudly. I wear that as a badge of honor. So everything you hear about me will be hashtag what's the little Wesley boy. Yes, I spent a numerous 11 years in Cuba. Most of my 20s, I must say. Just undergoing basic cardiovascular training to be able to provide efficient and good services to the people of Dominica and the Caribbean by extension. So yes, what exactly is a cardiologist? Cardiologists are doctors who specialize in the diagnosis and management of heart conditions. And those heart conditions are quite variable. They could range from heart failure to heart attacks to slow heartbeats to fast heartbeats to chest pain to shortness of breath to clots in lungs, fainting spells, anywhere along the line. And we see everybody who have heart. So cardiologists, this is what we do essentially. Yes, I am born Dominican. Parents are also Dominican, and this is home, and this is where we like to be. That's it.
Nice. So little Wesley boy, right? So Wesley Massive, if you're tuned in, Dr. Reef has said he's proudly representing Wesley as he always does. Dr. Reef, the heart, one of the organs that I think is the most critical as it relates to being alive. And people therefore get very anxious about anything to do with the heart. People hear heart disease and they panic, or people hear the heart is not functioning properly and they immediately would have this sense of doom and gloom. But this morning we specifically want to target, as I said, men's heart health. And I want to start to get the ball rolling with you by asking, what specifically, what sort of patterns of behavior or maybe physiological properties do men possess that present risk to their heart health? So when we talk about men, what are some of the risk factors specifically that we see, or that we maybe have to take into consideration specifically for women?
Okay. The heart. Okay. The heart is one of our more intricate and important organs of our body. It's unfortunately or fortunately one of the organs that our body cannot survive without. You might survive without an appendix, but you can't survive without your heart, right? It is said to be one of the most sensitive organs, but yet resilient organs. Sensitive, when I say sensitive, regardless of what you are experiencing, whatever your whatever your health condition is, your heart responds in one way or the other. I'll give an example. Somebody go to have fibroids and they go to have bleeding secondary to that, it produces anemia, your heart rate increases. Unfortunately, you go to have an infection, your heart responds in one way or the other by increasing its heart rate to compensate for it. You go to have a stroke, there will be certain changes in your ECG that reflects that you have a stroke as well. Your thyroid hormones will be high or low, that will affect your heart rate one way or the other. Your blood volume will decrease because you have a stabbing incident, you go into shock related to your heart as well. So again, it's one of our more sensitive organs when it comes to responding to everything that happens in the entire body. So it's very important we take care of it, we look out for it to ensure that we have a longevity in life and so. All right. When it comes to men, on a physiological level, fortunately and unfortunately, men happen to develop cardiovascular conditions a lot 7 to 10 years earlier than women. Why so? Because on a physiological level, we lack an important hormone which women possess, which is called estrogen, and that's what separates men from women. Estrogen levels being higher in women as opposed to men, or non-existent in men, and estrogen serves as a cardiovascular protector. When I say cardiovascular protector, it causes certain changes and modifications in the body that prevent women from developing cardiovascular conditions. How does it do that? It reduces the amount of cholesterol that is free and floating in the blood, right? So because it reduces the total concentration of cholesterol, particularly low density lipoproteins, it reduces the appearance and the frequency at which patients present with coronary artery disease. When I say coronary artery disease, I just simply referring to heart attacks and its family members. Okay. Also, it acts as a vasodilator. Okay, because estrogen causes secretion of something we call nitric oxide. Nitric oxide causes the blood vessels to expand, causing increased blood flow. So as well, it helps in terms of allowing the body to manage stress, and also because estrogen acts as a sweep for cholesterol, your body's better able to manage the amount of fats that is in the body.
Okay.
Right? In terms of preventing accumulation of fat, particularly around the visceral areas. Okay. This is the ability, and this is the default ability that women have and men lack. Right? So without that, men happen to have a lot more visceral fat at younger ages as compared to women. And women gain a lot of visceral fat past the 45 mark or past the 50 age because they now have estrogen cessation.
Lower estrogen,
right?
Okay.
But men, unfortunately, they have a lot of visceral fat, which contributes to an increased risk of development of cardiovascular conditions. Okay. As well, as I said, estrogen acts as a vasodilator by the nitric oxide secretion. So men tend to somehow, because of lack of estrogen, develop hypertension because of vasoconstriction, because there is not the vasodilative estrogen and nitric oxide present in the bloodstream to counteract that. All right.
Okay.
So we will see high blood pressure being something that men develop at a lot younger, 10 to 10 years earlier than women. Long-standing hypertension leads to chronic damage to our arteries, particularly our arteries that allow blood flow to the heart, which eventually leads to coronary artery disease. right?
Okay, so let's review that for a bit, because there's a lot coming in here, and I think it's critical for people to, to understand what we're saying. We're saying here that men, one of the risk factors associated with men developing cardiovascular disease 7 to 10 years earlier than you might see in women is that absence of high levels of estrogen in men. So you've very nicely told us all the good things that estrogen protects protects against, the cholesterol sweeping and the blood vessel dilation and so on, the visceral fats accumulation. So we're saying here that not that women, of course, are not prone or cannot have cardiovascular disease. Of course, we know that's not true, but we're saying that there are some physiological aspects in men that make them see cardiovascular disease possibly earlier than women do. And Dr. If you started to talk about visceral fat, and visceral fat accumulation is more pronounced in men. In women, you will start to see it more pronounced after they hit menopause. What is visceral fat?
Visceral fats, we just visceral refers to the soft organs that are in the stomach area. Okay.
Okay.
So when we talk about visceral fat, you're speaking about abdominal fat.
Okay, so that's the big belly, syndrome.
Exactly.
Okay, so we need to lay that down. People have to know when we talk about visceral fat, we're talking about that a lot, that belly fat, and we're seeing the absence of high estrogen allows men to accumulate that a bit easier. Yes. All right. So the big bellies, I somehow thought that was due to other things, but anyway, the big belly. The big bellies, the estrogen can prevent or protect.
Indeed. So for the most part, we've been laughing at everything because that's what we do best. We make everything a joke, but big bellies are not a flex, guys. So we need to work on that if that is where we are. And it's interesting because we kept saying that this show is also for women. So you just learned a very big fact about yourself. Normally when we get to hear anything in terms of hormones and women, it's always against us.
It's always negative, yeah, I know.
Right? So that is a positive for us. So we have a little bit of help. So we too should be pushing to stay off the cardiovascular disease radar. And I think that's really important to know.
I think it's important to make mention. It is it's not advisable to look for hormonal replacements to reduce your cardiovascular risk, because hormonal, unfortunately, here's the fortunate part about having estrogen. You have it acts as a cardiovascular protector. But estrogen is responsible for the development of cancer. That's why women tend to have cancer a lot more frequent as opposed to men. So while you may be protecting yourself against cardiovascular conditions, for that period, you may be increasing your risk of developing whatever cancers. So it's very important that we know this, because I said a lot. I know some people can translate some of those, which is not what we want to do yet. So also there's this genetic component. Somehow men with family histories of cardiovascular conditions tend to present with cardiovascular conditions secondary to that same genetic component earlier and more aggressively as compared to women.
Okay. So there's some physiological reasons why, men may see earlier cardiovascular disease, some genetic reasons. What about behavior, lifestyle?
Right. When it comes to lifestyle, we often say that because of certain practices, particularly smoking, which is very prevalent more so amongst men as compared to women. Although we find now that a lot more women are participating in smoking, men predominantly make up the majority of the population of smokers. And smoking in itself accelerates a process that we call atherosclerosis, right? Which is called hardening of the arteries, accumulation of fat in the arteries, causing decreased blood flow to all muscles of our hearts, resulting in heart attacks and high blood pressure and all this other stuff that we umbrella under cardiovascular conditions. Okay, so smoking, because men represent a higher population, and that practice predisposes them 3 times the population of the men who don't smoke. Men somehow, and for unfortunate reasons, they work longer hours, so and most of their jobs are more stressful and physical jobs, which puts a strain on the body. And regardless of how tough you are, if your body is under consistent stress and strain, it results in activation of something called a nervous system, which causes your body to go in overdrive. It's something that is intentional to last very short for a short period for fight or flight. If
Fight or
somebody to
flight.
frighten you, you were to go into the state of fight or flight where you just respond. Whether you scream or you pee yourself, whether you run, whatever the case is, it happens very quickly and it should be brief. Imagine your body maintaining that state of fight or flight chronically for a long time, right? It causes your heart to go in overdrive. Your heart beats faster, but it beats faster and it beats stronger, which is good for a period of time. But maintain your heart muscles grow weak and weary. Eventually, they become dilated and enlarge. So, because of the stress and the responsibilities, I guess, from home, having to provide, particularly, and working longer hours, men somehow are usually under stress for longer periods as compared to the female counterpart.
Yeah.
We have other associated stuff we have bad habits as men of not liking to go to see our medical professionals. Now, having already highlighted the genetic and the physiological components which you mentioned before, not having estrogen, and the likelihood of these conditions appearing at younger ages, plus couple that with not liking to go to your doctors or like not liking to go to your medical professionals to just get a routine check. You find that men know when by the time they are discovered and diagnosed with a cardiovascular condition, it has been existent for at least 7 years, 5 years, and it's far more advanced than it would have been. Women, on the other hand, don't mind pulling out the money and going by a doctor. They doesn't matter what they're experiencing, they will go by the doctor the most promptly possibly. Doesn't matter if you get them pain medication, they probably won't take it, but they will see a doctor week in, week out once they have symptoms. Men don't have that habit. It's I don't know, something that is taught traditionally, but generation to generation, we do see men who do not like to go to doctors. There are a few exceptions, but the majority, and even if they're given medication, they probably don't take it either.
That too. That's something we'll talk about a little later. But yes, the health-seeking behavior of men has been documented as being worse than that of women. I've been told by some other doctors we've had on the show that it seems to be improving a bit, but the statistics have shown that men tend to go to the doctor less, and that's something we want to try to, of course, encourage against. And so you speaking about it is good.
So you mentioned some in terms of women not necessarily going to the doctor for a treatment, but if you have any form of sign or symptom that you go into, just make sure everything is okay. So in terms of the cardiovascular system and the cardiovascular diseases, what type of early warning signs may you encounter as a man?
All right, early warning signs of cardiovascular conditions, and I say heart conditions, we just narrow it down to cardiovascular conditions.
Can be wide, yeah?
Correct.
It ranges from strokes to high blood pressure to heart attacks to heart failure to kidney disease to peripheral arterial disease to carotid stenosis. There are so many conditions at umbrella. But if related to heart, our early warning signs of a heart attack or heart failure are typically the typical chest pains. Okay? And there are many conditions that cause chest pain. How do we differentiate one from the other? How do I say, well, this is likely my heart's causing this chest pain, as opposed to my stomach?
My stomach, yeah.
Or my lungs, or my esophagus, any of them, because in the chest we have a few organs there, right? And those are the ones I just previously mentioned. How do I know it's likely this is my heart causing this type of chest pain? The chest pain that we tend to look out for are a pressure, squeezing, burning sensation located to the middle of your chest or to the left side of your chest. Okay?
Middle to left.
To the middle or side. We grew up knowing that the heart is located in the left side of your chest, but it's principally in the middle of your chest. Okay? We just correct that a bit. So a pressure, tightness, squeezing, or burning sensation located to the middle of your chest, often radiating, when I say radiating, moving or shifting towards the left shoulder, arm, and neck. So that's one of the particularities or characteristics of our chest pains that we associate with, particularly in patients who have a history of hypertension, diabetes, kidney disease, high cholesterol, and those kind of stuff. If you having those symptoms, you want to look out for that type of chest pain. That chest pain that feels like a weight sits on your chest, like an elephant sitting on your
It's
chest.
sitting on the chest, yes.
So often enough, the patients don't do this with their hand, trying to illustrate to the doctor, the medical professionals that they're seeing that, hey, this feels like a squeezing, right? So it's a pressure-like pain. What other symptoms are common? Shortness of breath. Shortness of breath, particularly when walking. Because what happens, your heart has difficulty keeping up with the demands of your body on exertion. So, but start backing up into your lungs and it causes that shortness of breath. What are the symptoms? Palpitations. When I say palpitations, it's a fancy word for saying where you perceive your heartbeat, where you feel like your heart is racing. You just sit down there and you just feel like your heart is racing. That is what we call palpitations. Okay. Other common symptoms are syncope. Syncope, again, medical terminology to say fainting. Okay, fainting. So you want to look out for chest pains, which is a pressure or weight-like feeling on your chest, shortness of breath, palpitations, right, and syncope or fainting. Okay, so those are the four classic. Now we could have other types of symptoms which are not so common, but they do still exist, right? And this do show up in particular in patients who have an atypical presentation, right? When I say atypical, that doesn't mean not so common, right? Because we have a wide variety of people out there. So we just want to make sure everybody understands the message has been transmitted. There's a selected group of people who do not present with the classic symptoms of cardiovascular conditions.
Okay.
And those are who? Those are our older patients past the age of 65, right? Of older patients, women often enough do not present with those classic signs, and our diabetics. Why? Our diabetics happen to have a condition which is called neuropathy, which sometimes either causes blunting of pain or they just feel like extra stinging and pricking kind of sensation, right? So because they may sometimes have numbness and blunting of pain, they may not present with a typical type of chest pain that all patients with MIs or heart attacks or any of those stuff present. Often enough, patients present with epigastrium pain, and they're talking about pain in the stomach area, not in your chest, but in the abdominal region, okay? Which is not the typical pain I mentioned before, which is located in the middle or the left side of your chest, feeling like a pressure. Instead, they present with an abdominal type of pain, okay? Or some other patients could just feel like excessive weakness and tiredness, fatigue.
Okay.
Right? So it's important to be a bit self-aware of what are my risk factors that I present, and couple those risk factors with the characteristics of the symptoms that I previously mentioned, and say, hey, this is something I need to check out immediately. You understand? And some cardiovascular conditions should be seen immediately. You have windows of 1 to 2 hours for you to get checked out before sometimes unfortunate situations may arise. So I guess that's the purpose of, I'm not guessing, this is the purpose of trying to bring awareness to particular these conditions, so that the situation of being too late or certain tragedies may not arise and so forth.
So some critical symptoms or signs, doctor, you've mentioned. I want to spin a little into something that I do not think is a commonly associated sign with cardiovascular disease, but which I've read specifically for men may be indicative of some sort of cardiovascular issue, and that is erectile dysfunction or inability to have and keep an erection. What may that say to a man about his cardiovascular health?
Yes, indeed. I may have missed that. Erectile dysfunction is very common, very, very common. Erectile dysfunction may suggest an underlying heart condition. Our heart is responsible for sending blood out to the rest of the body. Okay, so its major function is to accept blood and then to have it oxygenated by the lungs, and then send oxygen-rich blood to the rest of the body. All right, whether it be to the brain, to the superior arms, and the legs, and the rest of our body. whenever our heart function is not at an optimal, we expect that less blood flow or less oxygenated blood reaches certain tissues, right? And as much a drive you may have mentally, right? Or as much as an attractive woman you may have in front of you, if your heart is not functioning at an optimal and not sufficient or not highly oxygenated blood reaches certain tissues, particularly our genitals, we see patients tend to present with erectile dysfunction. And erectile dysfunction can present as not sufficient hardening enough of our male genital, or not or erection may not
Not
have the
last.
sufficient
Not
may not
last.
last. Okay, the duration may be cut short. So it's always important to have that checked out. There might be other tests that may ask you to do certain hormonal tests, but your heart function can contribute towards the development of erectile function, which do happen.
And that's usually an early sign too, right?
Yes.
Nice. You spoke about a few things. I think such important information, but really, I also wanted to know in terms of the men out there, right? Sometimes the factor comes in, and that's probably from a medication standpoint. But oftentimes, when you see persons with cardiovascular diseases, whether you have hypertension, you have high cholesterol, you tend to take possibly a myriad of different medications. And oftentimes you get persons coming into the pharmacy and they don't quite understand why they need six of them. So they will pick two and they will decide that's the two that they're taking. So maybe you can give us a little more detail in terms of why it is that persons who may have heart failure or who may have those cardiovascular conditions would need the different classes that we know about in terms of medication. Why it's so important adherence wise that you're taking all of these, and how skipping what you choose or what you pick to skip might affect your overall health.
Okay. And that is something that we see often. Non-compliance to medication and patients just not committing to the regimen that was set by the doctor or the health professional. And the reason why we doctors select certain medications, every patient's care is individualized, right? And your heart condition, there is a whole physiology and pathophysiology behind that, right? So based on the mechanism that we identify to have been the cause of your heart condition, we place an appropriate treatment to counteract that. I'm not sure if anybody understands that. So there is some intrinsic processes, stuff that happen within your body that contribute to the development of your condition. And how do we fight against that? Is by working against these particular pathways or processes that happen with your body. Each of these medications that are prescribed for your conditions have a particular role. So your self-determination to determine, hey, I'm going to take this one as opposed to this one, means that you're not getting sufficient coverage when it comes to certain processes, which could mean that certain processes that happen are unopposed, and your condition could further could worsen, right? So your doctors are not overly medicating you, as many people may think. It's just because heart failure and heart attack, there are about 3 or so processes that happen simultaneously. Now, if you have to get into the physiology, you hear about the RAS system, renin-angiotensin aldosterone system. You hear about the sympathetic nervous system. You hear about some other systems. Each one of these medications, each one of these systems, there are particular medications that work to inhibit them. The RAS system, when being activated, we give ACE inhibitors or angiotensin receptor blockers. The central nervous system, when it's activated, causing heart to go into overdrive, increasing heart rate and contractility, we give beta blockers, right? And there's certain other medication which will help you to debunk the amount of fluid that is built up inside your heart and your lungs and your inferior members, which will help you to pee a bit more, right? Stimulating diuresis, so that you're not as symptomatic as you came in to see the doctor. So it's very important to maintain your regimen as prescribed, not at the dose that you're that you want to take it, as prescribed by your doctor, so that you have the maximum efficiency of these medications. So if certain medications have to be taken twice a day, take it twice a day, because some of these medications they last for 12 hours in your blood. So if you take it for once a day, you only have coverage for 12 hours in the day. The other 12 hours,
The strain.
right? You make the sign of the cross. That's what we try to avoid. So it's prescribed particularly at regular frequencies so that you have 24-hour coverage and as well, it is indicated, certain medications are indicated to counteract certain processes that are undergoing which contribute to the worsening of your condition. So it's important, stick to the regimen, stick to what is prescribed by your doctor, ensure that you do regular follow-ups so that you can see improvement of your condition and not worsening.
I love this answer. And I ask this question because oftentimes persons do not grasp why. And when you have these type of conditions, like doctor said, you might also have other comorbidities. So then you end up having yourself, 7 different tablets, and all you're saying is this is too much. Or oftentimes persons, what we notice is persons who are taking multiple medications, each medication has its own dosage that they would give you. And what they tend to do is you might watch the dosage of this medication and watch the dosage of your other medication and decide that this one you have here, you might have lisinopril 10 milligrams. And then you notice that you have furosemide 40 milligrams, and you're saying this one is too high because I have 10 in this one, so why I have 40? They are not related in that way. And so we cannot gauge medication to medication what you would need. And oftentimes we might also notice patients who decide to take less or not take it because of that mindset. So it's important how Dr. Reef explained it, that each of these medications may be treating specific processes, different processes, and all together they will be helping whatever cardiovascular issue that you have, right? And oftentimes with the cardiovascular system, like Dr. Reef mentioned, you might have issues with the kidneys alongside that. You might have issues, you have your heart, you have your kidneys, you have issues with your other organs. And so it's important that the medication that you're taking, it treats each area that is allowing your disease to worsen. And you take all of these medications to help one to connect to the other. So when you take your high cholesterol medication, you're helping with that plaque buildup. That's helping with your blood flow. That in itself is helping your heart to do less work. And so you have to think of it like a circle, like concepts that are connected. And if you look at your medications that way, it's easier to understand why you are on them. Now, when you come into the pharmacy, you can always ask about your medications. We can give you more information about it. And as we go through with development in medications, we know that the manufacturers, they're finding medications that are usually prescribed together. And so they have been combination tablets, which can make it a bit easier so that you have less actual pills to take. So you can always ask about your doctor about that route too.
We've been on we're about midway of the show. I'd like to open the lines at this time. Of course, we're here on Health Vibes discussing heart health, specifically men's heart health, with cardiologist Dr. Michael Reef. And we see a lot of interaction through the social media platforms of Q95. But let's open up the lines now for our radio listeners to chime in if they need to. The numbers 449-3095, 449-3096, 449-3097, and 616-4257. For the people who would like to reach us and are overseas, the number for you is 305-432-9624. So here, as I said, with Dr. Reef discussing men's heart health, and we've been getting now into the realm of treatment, medication, the importance of adherence. I want to go into a bit of myth busting about medication. Since we're on the topic of medications, one of the common issues, Dr. Reef, you have mentioned as it relates to risk factors for heart disease, hypertension, high blood pressure, and of course, as a disease itself, a cardiovascular disease itself. So many myths about high blood pressure medication. And that is an area I want us to spend a few little minutes discussing, because I do know that we have certain things that people say often about high blood pressure medication, men in particular. We're getting a call. Let's take this call. Caller, good morning.
Judy, morning.
Hi, good
All I
morning.
want to say this morning, Judy, Dr. Reese is from Wesley. I want to say myself from Wesley. And I want to tell you, Doctor, I want to tell you, Judy, all our people from that area, we are bright, Judy. I want to ask Dr. Reese a question. Can you speak the Kokoi, Dr. Reese? When
Unfortunately,
people tell you
no.
something, Kokoi,
Unfortunately, no, I don't speak it, but I understand it fluently.
you can speak it,
You
Dr.
can
Reese.
understand it.
I can understand.
So you're from Wesley then. How you do, Dr. Reese?
I'm good.
Okay, bye-bye.
Okay, Ja Wesley. Yes, I was going into the aspect of the high blood pressure, hypertension, the medications associated with it, and we're speaking men's heart health. We're speaking men's health this morning. Many men, many men,
Thing you know.
many men say they're not taking blood pressure medications. Categoric no. I have heard this over and over, and the song that is sung is it will impact my sexual performance. It's not good for me to take. I'm not taking it, blah blah blah. I will just try to bring down my blood pressure by myself. I will drink whatever I'm drinking, but I will not medication. How can we address that particular claim or that hesitation, I would say, as it relates to high blood pressure medication? Okay. Dr. If I'll make you answer that after I take this call. I see we have a call. Let's just take this call. Caller, good morning.
Thank you. I would have endured, the doctor responding or whatever, because this is really sort of close to me. I've had friends who did not want to take high blood pressure medication for the same reasons that you're talking about.
Mhm.
And I would have asked them, truly, I do ask them, would you rather die than you not being able to have sex? And I do not believe in people talking about taking spray or whatever spray they're taking, for that, because these things are not measured scientifically. Some people take 3 litres, some people take 6 litres, and you cannot you cannot know how it works for you. And every individual, is different. I have a very good sister of mine, my first sister. You know what works for her? Tamarind. Tamarind is what works for her. And, when I taking coconut water with lime, I feel calm. And I believe it works a lot, for a lot of different people in different ways. But I'll never not take the medication prescribed to me by the doctor. Good morning.
Thank you, caller. Thank you so much.
I
Yes.
think it's important too that he said that, because we often think when we give medication, it's because herbal supplements and somehow do not have effect. They have effects, and like he said, they work. The problem is, unfortunately, in terms of studies and evidence, less is done on these products. And so when we talk about medication, there have been many studies, there have been trials. There are usually years and years before medication is approved and on the market. And so that's why it is prescribed to you, because the side effects are known. Mostly all of these things have been put down into evidence, the trials have been done against hundreds of people, different ethnicities, and all of these things help in terms of choosing the right medication. So it's not that herbal stuff do not work, but the evidence behind them, we don't know so much. And so it's safer to be prescribed your prescription medications.
We have a call on the line. Caller, good morning.
Judy, I want doctor to explain something for me. Explain a little more for me. When you mention about the absence of estrogen in men and they develop cardiovascular disease, like 10 years before women, something like that. You could explain that a little more for me, please?
Okay. All right. We will come back to that in summation. But Dr. Reef, I want you to take the question as it relates to high blood pressure, medication prescribed for high blood pressure, and the myths surrounding, not the myths, but the hesitation surrounding taking those medications.
Right. So yes, there are a lot of surrounding myths when it comes to um, high blood pressure medication, antihypertensives. Okay. Some of which are not actually myths, and there are certain truths to it, and you must highlight that. Okay. High blood pressure is a chronic condition. When I say a chronic condition, I mean a condition that you will have from the moment you diagnose until death. I repeat, a condition is a chronic condition that you have from the moment you've been diagnosed until death. It doesn't cure. Okay? It is often associated and known as the silent killer, which means that often enough it debuts with a heart attack, a stroke, kidney disease, or any of the other subtypes of cardiovascular conditions. Now, the idea of treating hypertension is not necessary to put you on medication. That is not always the first line. All right. So I do understand patients hesitant when it comes to like they want to take medication. Nobody likes to take medication. That's not the idea. The goal is to have your blood pressure being controlled. Whether it can be controlled of exercise, dieting, weight loss, simple education, or natural stuff, the idea is to have your blood pressure being controlled. Now, when you're unable to achieve doing so with those forms of these therapeutic options like diet and exercise, natural medicine, any of those, when you're unable to do so, you will be placed on medication. But again, because the goal is to do what? To ensure that your blood pressure is controlled. Now, it's just natural that patients do not like to go on medications. It's just very natural that they do not like to go on medications. But your doctor specifically selects certain medication depends on what exactly they think is causing or contributing to your high blood pressure. And while it may be a myth to certain people that, hey, particularly men, hey boy, I think that thing caught in my stand with that medication caught in my stand. Often enough you hear that because there are medications, antihypertensives that cause erectile dysfunction. Thiazide like diuretics, hydrochlorothiazide, all of those often enough causes erectile dysfunction. So you need to watch your population of persons that you're giving certain medication as health professionals. He's and I is in his 20s, in his 30s, sexually active, more active than the 60 or the 17, the plus 55-year-old male patient. You might want to substitute with something else as opposed to that. You might want to give an angiotensin receptor blocker, ACE inhibitor, something else that could has the dual function, helping with the erectile dysfunction and preventing erectile dysfunction, but also achieve blood pressure control. Now, I am not ever against the idea of natural medicine. Natural medicine, you can take your natural medicine. If you ask me, do I think you should solely do natural medicine? I don't recommend it. Why? Because there are certain things about natural medicine. Often enough, they're not, you don't know the dose exactly how much you take. There's not an anticipated effect as to how much, if you boil 2 bush, what exactly, if you expect the blood pressure to go down by 10 millimeters of mercury, if you expect it to go down by 20 or 60, we cannot judge the effect based on the quantity. Medications now, however, although they were plant-based when they made them, they were tailored to expect certain with certain expectation, therapeutic expectations from taking certain doses. If I give you 20 milligrams of a certain medication, I expect your blood pressure to go down by 10 millimeters of mercury, right? And they are already outlined based on wide range of study of 30, 40,000 people. What are the expected side effects that you may experience, right? Because unfortunately, as much as we don't realize it, some of these natural stuff that we take, they too have side effects, right? Some of them, they help with your blood pressure, but they thin your blood, you understand? Which increases your risk for bleeding. Okay? So do not think that your natural medicine, they themselves, they do not have side effects, right? So which would you go with? The one that is controlled, right? That we can anticipate the effects of it, right? one that is seasonal again, because not every bush is often always present and available. There's certain stuff that are seasonal, right? Or we go with the one that is controlled and we expect certain things, and we know it takes on, again, as I previously mentioned, there are certain processes, intrinsic processes that happen in your body, and these are the ones that we targeting. For example, if your blood pressure is high, 140, 150 on 150 on 80, but your heart rate is 112, I'm gonna give you something. I'm gonna say my likely concept of this is your heart rate is so increased, so it causes your pressure to increase. So I'm give you something that controls your blood pressure and controls your heart rate at the same time. Now, if you drink whatever water and whatever you want to drink there, and it doesn't have any effect on your heart rate, your pressure is going to stay the same way, right? So we target in certain processes with selection of with certain selection of medication. So your medications are tailored to whatever process we think is contributing to your high blood pressure. Okay. Again, I'm repeating, I am not against the idea and the concept of using natural medicine, but if you were to isolate natural medicine, right, and stop using the medications, I wouldn't recommend that. Again, I spent 11 years studying medicine. I can't tell anybody not to use it. Okay, and it really helps to really guide us as physicians as to where our patient is, what progress are we making, and that kind of stuff. So I do strongly advise against sticking to your medication regimen. But the goal at the end is ensure that your blood pressure is controlled.
Right.
One thing to add to Doctor's sentiment, though, like he was saying, in terms of knowing 20 milligrams of X drug would give you this, these things are done in sterile conditions in a lab, so you know that each tablet in that entire packet is 20 milligrams indefinitely. When we're dealing with herbs and bushes, unless it's done in the same type of process, and mostly here, you grow your thing, you pick your thing, whether it's by the road or you find it in the bush, we don't know if the strain of that particular bush that you pick here is the same in terms of its strength as the bush you picked last week. And so all of that contributes to not knowing the exact effect or side effect that you would get from that herbal medication. And that's important to note.
Dr. Reef, you said something, and I mean, you've mentioned it on previous shows, but I just want to reinforce as it relates to if there are particular side effects of an antihypertensive that you may feel, is not compatible with your lifestyle, that there are options that can be used or you can change to an alternative. So I just want to reinforce this aspect of communication with the medical provider when it relates to, well, medications in general, but antihypertensive, since it's such a big issue, so that conversation that would allow you as the patient to ask or determine that maybe another medication would be best suited to you based on your personal, your lifestyle. Dr. If you made a little you made a comment there about, for instance, the sexual activity of a young person compared to an older person, and the doctor might have to take that into consideration when prescribing. I think maybe some older people might disagree that is a statistic that is confirmed, right? That the 20 to 30-year-old might be more concerned about the erectile dysfunction than the 55 or 60-year-old. I think you might have gotten some kind of pushback on that, but the point but the point remains that a conversation can be had, with your medical your doctor. Yes.
Absolutely.
And you said something once on a previous show, and I think it has stuck with me. I'll repeat it here. You didn't say it here, but I'll repeat it because I remember. Is that in terms of hypertension, that is the condition with the most possibilities for medication.
Yeah.
So there will be something that will work for you.
Exactly.
Yes, that stuck with me because so many people complain about antihypertensives. And when you said that, I said to myself, this is critical, because it's not because you didn't like that one or whatever that, you should just decide you don't want to use any. There are a lot of options. Yes. Yes. So I see a lot of feedback coming in, as I said, through the the Facebook Live. I've been squinting to read because for some reason I'm not seeing, but I'm seeing a lot of commendations, Dr. Reef, to you and your presentation this morning. I I want to maybe take another medication concern before we move on, and we did have to reiterate the estrogen effect for the caller who asked. But a medication myth, not myth, I don't want to use the word myth, but a medication concern is statins as well. That's another one that people tend to um, say that they don't want to take or they should not take it for a prolonged period, and that is for cholesterol control. So I want you to address statins. You've addressed antihypertensives. There is a call though. Let's take this call before we get that question. Okay, we lost that call. Yes, Dr. Reeves, your statins.
Okay. Yeah. Statins are a core regimen of our patients which we identify have an increased risk for the development of cardiovascular conditions. All right. Our major process which contributes to cardiovascular conditions is a process we call atherosclerosis. Okay. I think I previously mentioned it, where it's hardening of the arteries and there's buildup of cholesterol. Okay. A lot of what we do in cardiology is based off risk stratification. And when I say risk stratification, I mean identifying whether a patient has a low risk, moderate risk, or high risk for the development of future cardiovascular conditions. When I say future cardiovascular, I mean a stroke, a heart attack, heart failure, if any of those, or they have a risk for death. What is the risk for death? Is it a low risk? Is it a moderate risk or high risk? Okay. Now, once we've classified our patients in moderate or high, right? Because atherosclerosis is our number one process contributing to those conditions, our statin medication is core in treatment of those patients. And it is indicated, and when I say indicated, I mean it is given to patients, these patients with moderate to high risk, irregardless of whether the cholesterol levels is high or not. It could be low. But because of a plaque buildup on our plaque, an essential component of our plaque that is within our arteries, whether it's in our brain, whether it's in our kidneys, whether it's in our heart, is cholesterol. To avoid further accumulation of floating cholesterol in the blood, it's essential for patients to be on statins. Statin medications are a group of medications that control cholesterol levels, particularly doing what? Reducing total cholesterol and our bad cholesterol, which is called low density lipoproteins, reducing those. Okay? In when it comes to cardiology, we have the plaques, and it maintains the architecture of our plaque that causes heart attack. Because if the roof of the plaque breaks away, it floats in the blood in the coronary artery, and it causes downstream obstruction leading to further heart attack. Something that we want to avoid. So it maintains the architecture of the coronary plaque, reducing low density lipoproteins and total cholesterol levels. So this is why we indicated particular patients with moderate to high risk of development of further cardiovascular conditions or high risk for death. Irregardless, and I repeat it, irregardless that these patients have normal cholesterol levels. Okay? It is not a medication that is only given over 3 months. Is a patient is once these patients, again, I have to tell you honestly, I've never cured a condition in my life. Unfortunately, cardiovascular conditions are chronic, which means that from the moment you've been diagnosed till death, you will have those. So I've never cured a condition, which means that these medications, because they are core and we want to avoid, again, prevention is cure. Prevention, we want to prevent worsening death and further events. We have to ensure that our patients are on statins. We can reduce the dose, we can increase the dose, but these patients require, those patients with moderate to high risk for further development of cardiovascular risk conditions should be placed on statins. Now, there are certain things surrounding statins, because if you were to Google and see the side effects of statins, nobody wants to use statins, but they are rare. And I'm talking about myalgia, pain in your muscle, kidney disease, liver disease, like they're countless, and they sound frightening to anybody who reads them. But they appear in a population less than 0.8% of populations of people who take them have those symptoms and those conditions and those complications. But they are core again because our plaque is essentially made up of cholesterol, and we need to avoid further accumulation, which will cause total obstruction leading to myocardial infarction, strokes, and kidney disease. And because at the end, when you're in kidney disease, you're going to have to end up on 7 other medication plus your statin. Plus your statin. Again, what happens again? When you avoid the statins, fats are accumulating into our liver. Most of our liver is now occupied with fat, means that we will enter into liver failure. And your liver is responsible for activating certain of our medication. If your liver fails, trust me, as much as our heart is important, our liver is one of the most important organs in our body. Because in there and the liver, we have activation of certain of the medication. If your liver fails, that's God's good. Nothing happen is God. Because your medication won't be activated, so they won't be effective in your body.
No, they won't be broken down.
They won't be broken down either.
Okay, so yeah, that's just another medication category that I know faces some resistance from patients as it relates to adherence and continuity of use.
care, yes. And somebody did ask if it is that when you start taking hypertensive medication, if there's a point where you can be off it. So I think that answers that as well.
When it comes to antihypertensive and suspension antihypertensive, ideally we don't. Hey, once you're hypertensive, give you antihypertensive. That's not the idea. There are certain situations which we automatically start you on antihypertensive. If you have high blood pressures with systolic pressures above the 180 and diastolic pressures above the 100, automatically you will be placed on antihypertensive. And sometimes it may not be one antihypertensive, as one antihypertensive may not be sufficient to control your blood pressure. Okay. Now, the other conditions are if you're unable to control your blood pressures within 3 months on lifestyle modification, exercise, diet, weight loss, any of those, unable to do so, you would require further assistance with the use of antihypertensives. Now, once you've been placed on antihypertensives, if you can work towards controlling your blood pressure without the use of antihypertensives, okay. Because again, the goal is always control of your high blood pressure. If you're able to do so, you say, all right, 3 months later, doc, I adjust my diet, reduce the amount of salt, the cholesterol. My weight has dropped by about 10% in 6 months. And some days I skip my antihypertensive and my pressure is being good. Most your doctor will tell you is for 2 weeks, write down your pressures for me for 2 weeks while you're off the medication. If you can show evidence that your blood pressure is controlled without antihypertensive, there's no justification as to why exactly, unless you have a concomitant condition like a heart condition or brain or stroke or kidney condition where you have to be on certain medications, not even for your pressure, but avoiding certain mechanisms and contradicting certain mechanisms that happen in your body. But if you're capable of showing evidence, 3 weeks documenting your pressures twice a day or once a day for 3 weeks of antihypertensive and their control, there's no need for it to be an antihypertensive.
I think it's important to note that during that entire paragraph, he said, your doctor, your doctor, your doctor. So do not do this on your own. There are a lot of people, and the thing is most likely, so that's evidence. So you're taking your blood pressure, so the doctor has evidence of what they look like. They might also run certain tests depending on what other conditions you have that this is affected by. And it's important that you go to your doctor to know when you can stop taking it and do this trial. And if after this trial, your doctor gives you the okay, then fine. A lot of times you also have patients coming in who say they feel fine. And Dr. Reef said that hypertension in particular is the silent killer. And what that means is your condition can be worsening, can be detrimental, can lead to death, and you don't necessarily have any grave symptoms. So some people, there are persons who only take the medication because they're having symptoms. It's not an allergy where you need an antihistamine, when you're having allergy symptoms and you don't take it when you don't. It's not pain where you take painkillers and you don't take it when you don't feel pain. It's something that's happening within your body, whether you can notice the symptoms actively or not. So if it is that you're on hypertensive medication, you don't stop just because you feel fine. So some people, they'll take it today because I felt a headache or I feel, weak. I take something, I take my meds, and then I feel great for these next few days. So I don't take it, and I only remember I have medication when I feel bad again. That in itself, you're leading, like Dr. Reese said, the medication has a time frame in which it works. That's why you're dosed that way. You're leaving yourself open to 5 days, 7 days of worsening condition. So it's important when we're making these types of decisions or we're looking forward, and that is something that we can now look forward to, because a lot of people often thought that once I'm on medication, it only gets worse. I only get more, I only get higher dosages. So he did say that your dosages can be reduced based on how your condition is progressing. If it is stable, your dosages can get less. You can go from 4 medications to 3. You can possibly also be off medication with the guidance of your doctor. So for your own health, I suggest that we do it with those steps in mind.
Yes, Dr. Reef, we are approaching the end of the show. However, there is a topic or a question that I need us to address. We're speaking specifically to men today. We said men's health is men's heart health. Men's heart health is what's our topic. We spoke a little bit, you just spoke a little bit about some of these lifestyle modifications that can assist with regulating conditions like hypertension and, of course, other cardiovascular conditions. Diet, you mentioned, exercise. Men are, known to enjoy certain physical activity, weightlifting being one of the major ones. And of course, men enjoy other activities, sports, and so on. When we talk about cardiovascular health and men, what are we looking for preventative wise, prevention wise in terms of physical activity? What should men focus on? What do they often not focus on? Let's get some feedback on men and exercise as we approach close.
Okay. All right. Ideally, we recommend exercise 3 to 5 times weekly. Okay. The exercise that we ideally recommend for cardiovascular prevention is walking. You can do something as simple as walking. Okay. I think most younger men don't really like to walk. To be honest, there's nothing entertaining about walking, particularly for men. We kind of put ourselves out more for the weightlifting, which isn't bad. And all for patients who do weightlifting, it produces resistance in your body and it really helps your heart to build a better foundation, right? But your exercise, let me just debunk, chores are not considered exercise. Your work is not considered exercise. That is still, if you're only working, that is still considered sedentarism. Okay? So we need to exercise. We can do the simplest thing. And if you want to do more, we encourage it. Okay? Walking, how do we walk? 30 to 45 minutes, and I'm not even talking about the brisk walking. You could do the casual walking, right? So you don't have to do the brisk walking like what you see in the Olympics. The casual walking for 30 to 45 minutes, anywhere between 3 to 5 times weekly, not allowing more than a day and a half to go between walking sessions. How does that help? It helps in many different ways. It helps to improve your circulation, right? It helps to prevent or control high blood sugar, because now your muscles now are becoming more active. They're absorbing sugar, which is present in the bloodstream, because when you eat, your body does 2 things with sugar. It either stores it away as fat or uses it to produce energy. If you're walking and you're staying active, now you're using that same sugar that you ate from whatever food that you ate. You're now using that sugar to produce energy, which has been burnt. If you're not active, it stores it away as. Okay? So the idea is to stay active, to keep moving. Whatever intensity that you want to do, you do it at regular frequencies, 3 to 5 times weekly. It sets up a core foundation for your heart. Your heart learns to adapt. That's why the athlete in high school, when you check the heart rate, it's somewhere in the low 40s. Right? Somewhere in the low 40s, and the blood pressure is about 100 on 60, because the heart has adapted to be able to function with the minimal amount of resources. The heart has got thicker, right? And in getting thicker and bigger and more bulky and stronger, it has found a way to be able to function using the least amount of energy, which prepares you for the future. It does. You understand? It really does help. So it's important during your youthful days to remain active and mobile as much as possible. So again, you're recommending things. You can do it at least at with least intensity by simply walking, but you walk in for 30 to 45 minutes, at least 3 to 5 times weekly, not allowing more than a day and a half to go between walking sessions. And we see the advantages that we previously mentioned. They help in your circulation of your blood, right? Whether it be in your leg, whether it be in your heart. It will help with control of blood pressure. It will help with absorption and use of sugar levels, and help with weight loss, preventing the visceral fat that we previously mentioned. As we are now breaking down, we're actively using sugar that is being ingested, and we break it down fat that is being stored to ensure that we reduce the cardiovascular risk and prevention, achieve prevention.
That's good advice, Dr. Reef. I do see a lot of men avoiding cardio. Walking is not something, that a lot of people do. A lot of men would, do. But that was some important advice, and something as simple as walking. And also that advice about your work is not exercise. So if you're working as a security officer and you're making your patrol, or you're doing, some construction work maybe, but you still need to get in that additional 3 to 5 times a week of committed exercise. Yes.
And it's important to highlight, particularly for our weightlifters, because often enough you go to the gym and you see the weightlifters, they're strong, they're pretty strong. Arms are big, chest is big, but their stomach looks pretty bum, right? It looks pretty round because they spend more time weightlifting as opposed to doing cardio exercises as well, which will aid in the decrease in the visceral fat and helping reduce the cardiovascular risk as well.
Yeah. So it is 11:36 a.m. here in the studios of Q95 FM. It's the time to go. The phones are going off the hook. However, we are wrapping up right now. So I apologize. You're just a bit too late in reaching out to us on the program. We are wrapping up. Dr. Reef, what I want you to do is to share your contact information with our listeners. If people would like to reach out to you, of course, to make an appointment, to check on their heart health, the heart doctor is going to give us his contact details now. So make sure to take those down.
Okay. All right. So I have this clinic. It's called Heartbeat Clinic. It's located at Asbury Medical Center. Our contact information is 285-9586. 285-9586. Again, for the third time, 285-9586. Heartbeat Clinic. The name is pretty much along with what exactly
what happens there.
Right? Heartbeat Clinic. Dr. Reef, 285-9586. Make your nearest appointment.
Yes, Hillsborough, of course, in Hillsborough Street there. So that's where you can reach Dr. Reef. For all the people who are maybe calling, wanting to have an appointment, that's where you can get him outside of Health Vibes. So we are at the end of the program. And Dr. Reef, it was a pleasure, of course, having you on. And I do see that quite a number of our listeners have been very appreciative of the information that you shared with us this morning and how it was delivered. I do extend an open invitation to you whenever you next have the opportunity to come back on Health Vibes. We do have a lot more that we could have discussed, right? We could have discussed. But before they kick us out of the studio, we're signing out here from Health Vibes for this program. It is the month of April. And Dr. Reef, what does that mean for us? When we're in April, what we looking for? We're looking forward to May. When we're in April, the May ones look forward to May. So until next time, Leona, we're signing out.
Indeed. Take care of your heart, guys, and make your appointments if you need to. We'll see you next week on Health Vibes.
That's right. Until next time, goodbye.
Goodbye.
Johnny's Pharmacy is bringing vibes to health with Health Vibes. Health Vibes each and every Wednesday from 10 to 11:30 a.m. with your hosts Trudy Kristen and co-hosts pharmacists Jacinta Fagan and Leona Jeremiah. Education, information, and a bit of humor, and not forgetting lots of vibes. Jolly's Pharmacy is bringing health and vibes together with Health Vibes. So be sure to tune in each and every Wednesday on Q95 from 10 to 11:30 a.m. Johnny's Pharmacy, leading the way in health.
Advertise where everyone's listening. Advertise on Q95 today. Get more bang for your buck. Talk shows, news, sports, music shows, entertainment events, weekend shows, Newsweek reviews, early morning shows, evening and daytime shows, hot tips on health, nutrition, security, traffic, weather, environment, and more. Place your display banners on the Q95 website, www.q95da.com, with live links to your own website. Advertise on Q95, your one-stop shop for audio and video streaming, breaking news, sports, and entertainment. Advertise on